In this video, we will be answering the question, who is at risk for uterine fibroids, along with potential modifiable risk factors, which someone can hopefully decrease their chances of uterine fibroids going forward. Welcome back. This is Fibroid Fridays, a series where we look to discuss and bring more awareness about uterine fibroids to the online community. My name is Eric Schmidt. I'm a board-certified OBGYN and a minimally invasive gynecologic surgeon. And here at the New School OBGYN, it matters a lot where you get your information. And so we're looking to bring that trusted information to you. To recap in our last videos, we know that fibroids are non-cancerous growths of the uterus. They are very common in reproductive age women, potentially up to 70, maybe even 80% in some populations. Because remember, they love hormones, but they don't always cause symptoms, luckily. That's only about 25%, but those that do get symptoms, they can be pretty disruptive. Now, the best way to identify these fibroids is by ultrasound, but we can visualize them with MRI or other ways too. Location matters a lot because that might make a difference in your symptoms and potentially your treatment options. We have identified various risk factors that may increase someone's chance or potentially decrease someone's chance of developing uterine fibroids in their lifetime. So let's go through them one by one. Now, just because someone may have a risk factor doesn't mean they're absolutely going to develop uterine fibroids in the future. It's just that chance may be a little bit increased. So if someone does have a risk factor, it doesn't mean that they necessarily need to rush to their doctor to be evaluated immediately. Now, often as we go through this, we'll learn that evaluation is often based on symptoms. Okay, we'll start out with what we'll call is the reproductive type symptoms. And now the first one is age. You might hear me keep saying that uterine fibroids, there's about a 70 to 80% chance of someone developing it within their reproductive years. But that 70 to 80% isn't at 20 years old, maybe not even at 30 years old. That's probably closer to 40s, getting closer to 50, where that chance is about 70 to 80%, and that smooth muscle and those fibroblasts within the uterine muscle eventually start to proliferate to make that fibroid. It takes potentially years for that to happen. And then we do know that with age beyond menopause, fibroids, if they're not causing further symptoms, likely shrink a little bit and become inactive or calcified and don't cause as much of those bleeding symptoms anymore. Another risk factor is the early onset of menstruation, or we call this menarche. We have noticed that women who do start their menses or they have their menarche earlier, and this would be usually less than 10 years old or sooner, may have an increased chance of developing uterine fibroids in the future. And this may be linked to the first point that we talked about, because potentially with more menstruating years, there is a higher chance of potentially developing fibroids. Now, the next we'll go over is prior pregnancies. If someone's had a pregnancy, specifically they say beyond the 20-week mark, it decreases your chance of uterine fibroids. Often one of the biggest questions I get or statements I might hear in clinic with someone with fibroids is that maybe their mom had them, their sister, their grandma, and needed treatment for the uterine fibroids. And so there is some genetic link or family history of uterine fibroids that may increase your risk, but specifically your first degree relatives. So that'd be your mom or your sister. If they've had fibroids, your chance increases too. Genetic factors may play a role in their development, and we'll talk about this more in an upcoming episode. Another factor would be race and ethnicity. Now, African American women do have a higher chance of developing uterine fibroids within their menstrual years. And this chance may be 2 to 3 times increased risk. And unfortunately, often a lot of these patients are having more severe symptoms and larger fibroids too. Now, I keep saying within the series that fibroids love hormones. However, this hasn't shown to be true when it comes to people taking in hormones such as low-dose birth control pills. Actually does not increase your risk of uterine fibroids. And there may be some data to support that some progesterone options may decrease their size. Okay, so actually obesity also increases someone's risk, and it's not fully understood, but the thought is that in peoples with obesity, that increased adipose tissue increases the estrogen in the body, might feed these fibroids, and so obesity is an increased risk of uterine fibroids. All right, so we're gonna move on to diet and a good modifiable risk factor, because we found that red meats and low fruit and low vegetable diets increase someone's risk of fibroids. And so hopefully decreasing the number of red meats, not saying you have to eliminate them, but decreasing and also increasing the fruits and vegetables might decrease someone's chances of uterine fibroids in the future. They're also kind of making the link between psychological stress and the development of uterine fibroids. And so hopefully we can all reduce our stress and decrease our chances of uterine fibroids. And lastly, I'll say is hypertension or high blood pressure may increase someone's risk of developing uterine fibroids in the future. We did go over a lot of risk factors there about someone developing uterine fibroids. And let's always keep in mind that fibroid growth and development is multifactorial. And so again, not one of these factors is going to absolutely guarantee that you develop uterine fibroids. But hopefully we can start to change some of these things that we're knowing about fibroids, improving things like diet and decreasing our chance of uterine fibroids in the future. All right, everyone. So that is going to finish our episode on risk factors. And so once again, as always, thank you so much for viewing. You don't know how much it actually means to us and how much it drives us to continue to do this, continue to improve, to bring you good, valuable, and hopefully fun content about uterine fibroids. And so if you haven't, please like, subscribe. It helps us out. So we'll see you on the next one. All right. Bye, everyone.